Living with PNH. How to be proactive with your doctor concerning your PNH care. You will see a real patient participating in two scenes. However, the situation has been generalized for educational purposes. In the first scene, look for what can be improved.
Hi, how have you been?
Oh, all right.
Would you like us to talk about how PNH is a lifelong diagnosis and how this may affect you?
It's also overwhelming. I'm sure it's going to affect my work life somehow.
Do you have specific tasks at work that you may be concerned about?
I haven't thought about that. I'm just trying to process this whole deal with the new diagnosis.
I know PNH is a new diagnosis, but it's helpful to think about specific tasks at work. This will allow you to consider how this disease and the treatment that it involves, how it may impact your work life, and then discuss what accommodations you may need at work.
Oh.
Do you have any other questions today that we need to talk about?
Not right now. I'll let you know how it's going at work.
Okay. That didn't go so well.
I'd like to do that over again and be more prepared.
This second scene shows how you should prepare for discussing the treatment options and possible effects on your work with your doctor.
Hi, how have you been?
Oh, all right. But I have some questions about my new diagnosis of PNH.
That's great, go ahead.
How will PNH affect my work life?
Can you give me an idea of what you do for work and what specific tasks you do?
Okay, I work for a technology services company. I work 8 hours a day, and sometimes I do extra hours. I do a lot of sitting, and sometimes I go to the client site and have to do some heavy lifting.
You'll still be able to work, but you may experience fatigue from time to time, and you may not be able to lift heavy items. If you have been sitting for a long period of time, you may have to get up and walk around because blood clots are a big concern in PNH. You also may need to take some time off for treatments.
But what are my treatment options that's available to treat my PNH?
There are several treatment options that are available to treat your PNH. The typical classes of drugs that are being used are called C3 and C5 inhibitors. The two most common ones are administered by IV infusion, and a newer one is subcutaneous. But the most exciting is that there are newer agents that are under development and very close to coming to market that target a different area of the complement pathway, which is where the disease occurs, and these are oral.
So how will the treatment impact my home and my work life?
You can expect needing blood work frequently. Initially, you may require blood transfusions. The blood work may be a bit more frequent. As far as symptoms go, the patients usually tolerate the treatment very well. You may have to come to the infusion center to receive the treatment, which can take several hours of your day.
What side effects are possible?
The most common side effects are infections. Before you begin your treatment, we will vaccinate you and sometimes also begin therapy with antibiotics to prevent bad infections such as meningitis. Sometimes patients may experience infusion reactions, and these are treated at the time. They are almost never the reason for discontinuation of therapy.
So how will I manage any potential side effects?
Should any side effects arise, the treatment will depend on the severity. The treatments are mostly preventative, so you don't experience any side effects.
This is a lot of information. Do you have any books and resources you can give me to take home to try to digest this?
Yes. I have a patient PNH toolkit, and I also have some reading material from a patient advocacy group, AAMDS. I think you'll find these very useful.
My employer requires me to get medical documentation from my doctor in order to grant me FMLA leave. Is that something you could get for me?
Absolutely. We can have this ready for you if you don't mind waiting. That went a lot better.
All my questions were answered.
As a PNH patient, prepare questions about treatment options and how you will be impacted before you meet with your doctor. Ask your questions and keep a record of the answers. Be sure to ask about additional resources too. If you need medical documentation to qualify for leave or other accommodations, ask for it. Being proactive will be a big help on your journey. For more resources about living with PNH, visit aamds.org/living-PNH.